Episode number 167 of the Wholesome Fertility Podcast. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist here to provide you with resources on how to create a wholesome approach to your fertility journey. My guest today is Jaclyn Downs. Jaclyn is a functional nutrigenomics practitioner that specializes in fertility optimization. Rather than forcing hormones to be in specific levels to achieve pregnancy, Jaclyn uses genetics, functional lab testing, and a very in-depth case history to identify and address root causes of imbalance. She then uses this information to create personal protocols for each individual. In addition to her own clients, she offers practitioner consults to review their patients' genetic reports to identify potential genetic weaknesses in things like antioxidant production, phase 1 and 2 liver detox pathways, improperly used iron, and issues with proper fat utilization, all of which are contributing factors to inflammation and oxidative stress that derails fertility. So welcome to the podcast, Jaclyn. It's been a while. We've been meaning to do this for a while. So welcome finally.
Thank you. It feels so good to finally be here and to be seeing you and talking with you.
For sure. So for the listeners, I'd love for you to introduce yourself and your background and how you got into the work that you do today.
Okay. It's kind of a long story because my former career is in birth work as a doula and an apprentice to a home birth midwife. I had an on-call doula collective where we offered workshops on all kinds of things from cloth diapering to baby wearing to, daddy doula kind of stuff. And I also have always been interested in nutrition, and I am a certified health coach, and I have 2 years of grad school for holistic nutrition. And I started to become a research assistant, or I became a research assistant for a local naturopath back when he hired me just to research MTHFR. And that quickly escalated to many different genes, many different pathways, and became the functional genomic analysis that it is now. And so I took my knowledge of birth and fertility and merged it with the epigenetics and nutrigenomics. And now my title is a functional nutrigenomic practitioner. So what that means is that I work with clients and practitioners. I train practitioners in this as well. I can look over their clients' genetics, and using a very in-depth intake form and looking at genetics and doing some functional lab work, we can really create a personalized roadmap for each individual client. So we can look at causes of inflammation that, 5 people can have a certain diagnosis, but there can be 5 different reasons for that diagnosis. So there's 5 different plans of action. So no one certain protocol or, boxed protocol fits on everybody.
Yeah, treating the person versus
Absolutely.
the symptom.
Yep.
Yeah, I love that. Yeah, that's how we learned.
Underlying reasons behind it. Yeah.
Right. That's awesome because, I'm sure that it gives you so much information. And my first thought is like frequent miscarriages, people who really don't understand why they can't carry to full term, or because it definitely is, it's a lot of detective work to really get to the bottom of why this is happening.
Mm-hmm. Yes. Yeah. Rather than just forcing the hormones into a specific range, let's find out why the hormones are out of range. And there's unfortunately a plethora of reasons for that in this modern day, filled with toxins and, poor food quality. But so, there is quite a few things to investigate, but I'm thankful that we have the technology for so much of the lab work that is available out there. There's so many tests out there that people don't even realize that are out there. Like some people say, oh, it'd be nice if there was a test that could check this. Well, there probably is.
Yeah.
You just need to know the lab or a practitioner that'll run it for you.
So I know that obviously you get to the root cause and every single person is different, but what are the common things or common reasons why somebody should check? I know if they're going through fertility challenges, but what are the things that you see, the common things like miscarriage is one of them. What other things get in the way of people getting pregnant and having a full term pregnancy?
Very commonly, I'd say, and I write about these in my book, Solving Unexplained Fertility, your 12-week functional fertility plan. Each week addresses a different root cause. And so some of the big ones that I see over and over and over again are poor fat utilization. So
Hmm.
these people might be on a diet that has a lot of good fats in it, but if your body isn't able to digest or utilize it and get it into the cells, then it's not going to have the fats to make the hormones.
Right.
And something called lipid peroxidation can happen where the fat actually will oxidize and cause inflammation and oxidative
Oh,
stress that
interesting.
damages the structure of the cell and the information contained within the cell. So we
Wow.
can use genetics as a framework to see where in the whole pathway of fat utilization there might be a wrench. And then
Hmm.
we can use functional lab testing, like the urine organic acids test has about 8 markers for how well you're using your fat. So we can look at the genetics and say, okay, well, you're predisposed to these things and you're having the symptoms like floating stools or light colored stools or really dry skin. So let's do the lab testing and confirm if that's happening, and if so, to what degree.
So the
Another
dry
thing that
skin would show that your body's not utilizing it, not producing enough oils.
possibly, I tell my clients that water is the hydration for the body, but fats are the lubrication. But
Hmm.
fats also are needed for your brain. Your brain is a really high percentage of fat, and your hormones require cholesterol. Cholesterol is the precursor to all sex and stress hormones. So,
Right.
first off, if you're not eating enough, then you're not going to have those precursors. But if you're not able to properly use it, you're not going to have those precursors. But then there's that whole inflammatory component of the
Hmm.
misutilization of the fats.
Wow, so interesting. So what do you do in that case? Like what is the treatment protocol?
There depends on where the wrenches are and what markers might be elevated, but a really common helpful, there's my two favorites are carnitine
Hmm.
is one of them. That helps to shuttle the fat into the cell so the cell can use it to make ATP and do all the functions it needs.
Interesting. Yeah.
And phosphatidylcholine is a major component of bile, and bile is what emulsifies your fats so
Hmm.
that your body can use them. And also, your bile is what takes the toxins from the liver and escorts them into the gut, so it helps your liver detoxify. And so another point segueing out of fat utilization issues is detoxification. So a lot of
Hmm.
people say, oh, I'm going to do a liver detox, but there's there's quite a protocol. I don't recommend anybody just start doing a liver detox, because if your
Sure.
channels of elimination aren't open, then those toxins are just going to get recirculated. And the
Right.
medical term for that is enterohepatic recirculation. So you
Right.
want to kind of I write in my book that you want to take a bottoms up approach. So you make sure that your channels of elimination are open. Then you want to make sure that your bile is flowing to be able to take the toxins out of the liver and put
Hmm.
them into the gut.
What does a
And
person do if they don't have a gallbladder?
they are, unfortunately, they're going to need to, well, fortunately and unfortunately, right, we can supplement to compensate for that. So I recommend things like ox bile or
Hmm.
TUDCA to since your body's not producing it anymore, so you're going to need to take an animal based form to help supplement for what your body isn't producing.
Right.
And I recommend those supplements for my clients in the short term, that for the ones that do have gallbladders, if testing warrants that. But then I don't want the body to become dependent on that, so I'd rather have you make it than take it, so we can support the body to jumpstart and get the pathways open. And then the idea is that the client won't need those in the long term.
Yeah, and I think about Quicksilver Therapeutics has a push catch. Have you heard of that?
My
Yeah,
favorite supplement company, by the
therapeutics.
way.
Yeah, so
Yeah.
scientific is it? I said therapeutics, scientific. So
Yeah.
Quicksilver Scientific
Mhm.
has push catch, which
Mhm.
is great because it gives you the bitters, which takes out the toxins, but then it has the bentonite clay and the um, activated charcoal to take it after 30 minutes, where it binds and helps remove it from the body and not just allow it to kind of sit around.
Yes, with any killing protocol or detoxification protocol, you're going to want to bind those toxins. So I do always recommend them in conjunction, at least for a period of time, because you want to make sure that the toxins that are getting released are getting escorted out of the body. So
Right.
it's nice to have them bind to something. So I completely agree with that. Yes.
And then let's talk about the different ways that we can escort the toxins out. We know the colon and the liver. The liver really moves them through, but like really the colon is like a big one.
Yes, and a lot of people forget about the kidneys, though. A
Right.
lot of stuff is eliminated through urine. So, a lot of the testing that I run, which is the Dutch test and the urine organic acids test, even neurotransmitter tests, some of them are urinary and they can give you some insight. So, your urine is like your car's exhaust. It tells you what your body has utilized and now has gotten rid of. So, that's why I love the Dutch test, because you can measure what's in the blood, like your hormones or your B12, but that's not telling you how much your body has used and how much has gotten into the cells and you're now getting rid of. So we always want to make sure that we support the kidneys as well.
Hmm.
A lot of people just focus
Right,
on the
that's true.
liver and the
Yeah.
colon, but yeah, the kidneys are important as well. But also knowing which toxins you're dealing with
Hmm.
can really get you targeted precision detoxification, because certain toxins have affinities for certain detox pathways, especially when it comes to mold and mycotoxins.
Hmm.
So a lot of functional medicine practitioners will say, oh, you've been exposed to mold, let's give you some glutathione.
Hmm.
But glutathione studies are showing that it only is really effective at removing aflatoxin B1 and ochratoxin A. And so if those are not the type of mycotoxins that you're dealing with or you've been
Right.
exposed to or that are colonized in your body, then glutathione isn't going to do a whole lot.
Right.
So you need to support other liver detoxification pathways like the glucuronidation pathway and the sulfation and acetylation, which I detail in my book. And so if can I just tell about my book, because
Absolutely. Yes. Please.
it's for lay people, but there's so much biochemical and genetic information like this that I'm talking about that I put it into appendices so it can support the practitioners to have better tools,
That's
but
great.
it's not just going to be over the head of the average layperson either. So it's nice that the average person that wants to learn about, root causes of what could be causing their fertility challenges, but also it's for practitioners who want a deeper dive into things like oxalates and phase 2 liver detox and
Hmm.
antioxidant production and the genetics related to it.
Yeah, for sure. And then something else that I think about is, and I think about this often, and I actually just spoke to Dr. Vidali in the last episode about how he said that after an IVF treatment or retrieval, when you're getting a lot of estrogen. So basically, he had said that he sees a significant difference in endometriosis after retrievals or IVF, IVF retrievals, whether it's freezing or for IVF, where they're getting a ton of estrogen into their body. And that is something that I
Mm-hmm.
think about. It's really, really important to focus on detoxifying the excess hormones in general.
Absolutely. And there's genetic predispositions for that, which they show in some of the Dutch interpretations. But if you have certain CYP variants, which is a phase 1 liver detox, you're going to be predisposed to your estrogens maybe going down the 4-hydroxy pathway, which is the quote unquote breast cancer pathway,
Right.
super, dirty estrogen. And then also there's other genetic variants that can upregulate estrogens going down the bad pathways or downregulate the good estrogenic pathways. So knowing your
Right.
genetics as a framework can really help to navigate potential problems, or be helpful for correcting problems.
Hmm.
So knowing your genetics is great.
So, who can benefit from getting genetics testing?
everybody. I have clients of all sorts. I have, 60-year-old men with gout, and I have children, but my passion is in fertility.
Mm-hmm.
But because the genetics are there, because inflammation and root causes of inflammation are for everybody across the board for all kinds of chronic illnesses. But because I have a passion for fertility and hormonal balance, that's sort of where I curtail it to.
Mm-hmm.
But really anybody can, but knowing your genetics is not a diagnosis. Like I keep saying, we use it as a framework so we can sort of see what genetic predispositions you have and know how to better support them if there are genetic weak links that are confirmed by lab testing or symptoms.
Right. It's so fascinating, but it also, there is a tendency for the genetics to really get activated or deactivated based on environment, and that's what you mean by like curtailing the treatment based on that.
Right. We don't ever want to treat a SNP. A SNP is a genetic variant.
Right.
The most common one is MTHFR
Mm-hmm.
that people know about. I almost titled my book MTHFR as a gateway gene.
Mm-hmm.
Because you might say, oh, well, I have this genetic variant, so I need to take this high dose of something. But 80%, 85% studies show, and I have the statistic in my book, that environment is what will affect your genetics. So the epigenetics are affected more by your environment than by the actual genes turning on, because there's just a strong genetic predisposition.
Yeah, it's fascinating.
Mm-hmm. Really is. So that's why when people give you the genetic report with the canned response of, you have this genetic variant and so you should do this, or take this supplement or stay away from this, you have to look further upstream and downstream and look at the client or patient themselves and know their history and know what they've tried and the toxins and exposures and stressors that they've had.
Mm-hmm.
Because just because you have the variant doesn't mean it's expressing, but it's nice to know that maybe it would
Right.
someday if it's not, and how to support that.
I had Dr. Bruce Lipton on a while back, and it was really interesting how he was talking about our minds and how that impacts really the internal petri dish, which is our blood. Because he had, you know his work, right? He's like studied a lot of
Yes.
stem cells, changed the environment, and then they grew into completely different things, and they all started out the same. And it's crazy fascinating, like how just the mind itself can impact the environment which these cells or the genes respond.
It's so true. I completely agree. And the crazy thing is that it passes down generationally too.
Yeah.
And one physical reason for this, energy aside, is that when a woman is 4 months pregnant, she if she's carrying a female, that female fetus at 4 months gestation will have all the eggs it will ever have. So the mother is actually carrying the seed of her grandchild in her womb. It's just so mind blowing.
It is mind blowing. Totally.
Going back to what you had mentioned about endometriosis and the hormones, that actually there's a link between oxalates and endometriosis. Oxalates are compounds that are found in plants that can bind to minerals and create jagged crystals and cause a lot of inflammation and derail hormones. And the excess estrogens can kind of take a wrong turn if there are any kind of oxalate sensitivities or gut issues that might predispose somebody to having more oxalate issues. And then there are genetics that can predispose people as well, but a lot of people just have them due to gut issues or mold exposure or poor fat utilization. But I did want to just point out that the hormones that people are given can cause histamine issues and oxalate issues if there are the right ingredients to create that perfect storm.
Right. So like certain foods that they eat can impact their response to the estrogen.
Absolutely. Yeah. Because estrogen and histamine feed each other. And so that might be one reason why a woman gets migraines around ovulation when her estrogen is highest, because the estrogen is fueling the histamine, and then the histamine response is a headache or vomiting or some sort of other digestive distress, something like that. So not all histamine issues are hay fever type symptoms. They can be body temperature regulation, they can be circadian rhythm issues. And like I said, they can affect your period, they can affect your GI tract and all kinds of stuff in the body.
And so if somebody has that tendency to be more sensitive to estrogen, it gets worse given that environment. So you'll look at like certain food sensitivities or how they respond to what they're taking into their body.
Yes. Yeah. So, and I want to put this disclaimer out there that I'm not telling people not to do healthy foods like spinach and avocados and kombucha and stuff like that. You have to take the whole person and their body into the picture, into consideration, in order to recommend something like that, because I don't like recommending that people cut out entire groups of food or types of food, because it's that variety of food that feeds your microbiome and creates that diversity. So you can experiment with maybe a food elimination challenge for a period of time, or like I said, there's all kinds of testing out there for all sorts of things. So before you want to just go and cut something out forever, you can either do a challenge or do some testing.
Yeah, I mean, ideally, they would talk to someone like you or talk to somebody who really understands how to test and what to do with that test and how to respond to it. For food elimination challenge, there's many different perspectives. How do you recommend for people to do that if they want to try?
Depends on what type of food. Oxalates are a whole different elimination challenge than, say, like going gluten-free or dairy-free or low histamine, because with those, you kind of just want to go as low as you can right off the bat. But with oxalates, they get sequestered in the body, and they can get sequestered anywhere in the body, depending on where your weak link might be. And so if you all of a sudden go low oxalate, then something called dumping is going to happen. And the oxalates are going to say, hey, we don't have them coming in. Let's start cleaning them out. And they'll all come out of the woodwork, and you can actually have an increase in symptoms or a flare up. So with low oxalates, it's something that you want to do very, very slowly and support with specific minerals or ingredients, because that will help with the elimination of the oxalates.
Yeah, I would definitely suggest work with somebody on this. It's one of those things that I think you're just much better off working with somebody who really understands this.
Absolutely. Yeah. And fortunately, a lot more people are learning about oxalates. My colleague, Emily Givler, is really brilliant. She's my best friend as well. And she is lecturing for Great Plains, and she's in conferences. And so she knows so much about oxalates, and I have taken what she has taught and curtailed it to how it affects fertility and hormones, because I am seeing lots of times that oxalates are an issue for many of my clients. So that's another point, in addition to the poor fat utilization and the liver detox issues, is oxalate issues.
So typically, and whatever I'm asking you, I'm not suggesting people just kind of do this on their own, but typically, what do you do? How do you usually implement it or have them slowly remove it?
Okay, so I usually start out with them avoiding the big five, which are spinach is the number one highest oxalate food, and it's also high in histamine, which a lot of people don't know.
That's so interesting. Yeah, because everybody thinks it's the best.
Yeah, and I actually have some oxalate resources that I'm about to put up on my Instagram, which is Functional Fertility Solutions, and some freebies about it, because I want to spread the word about it. And one of them says, could your green drink or your green smoothie be actually contributing or causing your infertility issues or challenges? Because a lot of people think that these really healthy foods are helping them, but again, it really is different for every single individual body.
It is. One man's food is another man's poison.
Totally. Yeah. Yeah. So spinach, Swiss chard, beets with the beet greens. And then the last two I sort of change depending on the season because rhubarb is really high, but not very many people here in the US eat rhubarb aside
Yeah.
from in the spring and some pie or something. And then I do mention almonds and sesame because sesame is in tahini, which a lot of people eat hummus. But almonds, because a lot of people are going gluten-free, and almonds are the highest oxalate nut. And so like almond flour is an insane amount of ground up almonds. And so I just caution people, maybe use less or start, switching over, but don't cut it out completely. Right. Go slowly over a period of weeks. But yeah, you might want to make different choices besides almonds if that's something that you're doing, the almond flour breads and the cookies and who knows what.
Yeah, that's true because people go gluten-free, but they might have other sensitivities, and then they're going to increase that a lot more, which is why I really do believe in testing, especially if you do have symptoms and you are dealing with fertility issues or frequent miscarriages too. I mean, all of that can impact our whole reproductive reflection.
It's so true. And, the testing can be really revealing. I just had a client who she did a food log for me because I just like to know, what she's putting in her body. And I asked her, I'm like, well, you have dairy, like at almost every meal. Do you think you could have a sensitivity? And she said, I don't get any bloating. I don't have any digestive distress. I don't have any skin problems. So I doubt it, but we ran a dairy zoomer and a wheat zoomer on her. And she kind of had some sensitivities. Like she kind of thought maybe she might have a sensitivity to wheat, which the test showed, but a moderate, but her dairy was off the chart, lighting her up, but it's systemically. Wow. So she wasn't having any GI issues, but it was affecting her immune system. And that could definitely be probably the primary culprit, but there's usually more than one. But seeing that was a way for her to realize like, whoa, I need to stop eating dairy. I never would have known had I not done this test because doing an elimination, I didn't have any symptoms to begin with. So doing an elimination challenge would just kind of be a stressful nightmare for her. But now that she sees the results, she's way more motivated.
Right, because it gives her like a real definitive reason she can like really see.
Yes.
And also, I find the same thing with gluten. It's one of those things that everybody responds to differently. The sensitivity manifests differently in every person. And a lot of times people think, oh, well, I need to feel bloated for any issues, and I don't feel bloated. It's the same thing, but it manifests so differently for so many different people.
It does. And a lot of people don't realize that cognitively and neurologically it affects you. But also in this client's case, the gluten was creating the leaky gut that was creating the immune response to the gluten. So that is a case for her to do gluten-free for a bit.
Yeah.
Something else. In gluten elimination challenges too, people respond differently. So some of my clients have noticed within 3 days that they didn't need a second cup of coffee or they had more energy, but then other people didn't notice anything at all until they reintroduced the gluten. And then they were totally floored. So even the reintroduction and the way it affects you is different for everybody.
It's true. And it's sometimes, well, I know for myself, when I was younger, in my 20s, I would have pizza. I was working in New York. I'd have pizza for lunch some days, and I'd come back. I could not function. I was so tired. And I realized, like, it just over time, I realized it really makes me bloated, and maybe I'll try to eliminate and see. And I'll tell you, my bloating went down so much, significantly, but my energy, that was the huge thing. It increased so much. And there was a time where I had gluten-free pizza, and I think automatically I thought once I eat this, I'm going to be really tired after because I was so used to and conditioned to eating regular pizza and it making me so tired. And when it didn't make me as tired, I mean, it is a carb, so it does cause you to feel a little tired. But when it didn't make me as tired, that was such an awakening for me. I was like, oh my God. And the fact that I have more energy now than I did in my 20s because of my change of just gluten is huge.
Yeah, and that's a good place to start if somebody has chronic aches or fatigue or something, because there are a lot of nice gluten and dairy alternatives. So I tell my clients that the 5 most commonly consumed foods are the foods that are the 5 most common food sensitivities, because your immune system's reacting to it. And they're wheat, dairy, corn, soy, and eggs. And not wheat, sorry, gluten, dairy, corn, soy, and eggs. But these days, gluten and dairy are much easier to eliminate, at least with a challenge,
than for sure.
Corn, soy, and eggs, which are in everything.
Yeah, that's true. It's true. Those are so hard to avoid. And so for people who want to work with you, how can people find you?
They can find me on Instagram. I am at Functional Fertility Solutions. And my website is functionalfertilitysolutions.com, or just my name, jaclyndowns.com. They take you to the same place.
Awesome. Well, I'm excited for your book. I'm definitely gonna check it out when it comes out. And you got to let me know when it does publish, because I know you're in the process of publishing.
Yes, getting there. So I'm hoping, by mid 2022, if not before, it will be out into the world for everybody to read. And a lot of what we talk about and what we touched on today there's whole entire chapters based on what we talked about.
Fantastic. And then people can always go to your website and follow to make sure that they don't miss it when it does come out.
Yes, I actually have, you can sign up there for any kind of pre-sale notifications or information about the book as well. You can just get on the mailing list.
Awesome. Well, Jaclyn, this has been so intriguing. I feel like I have so many more questions, but that could be a whole other episode. It's really fascinating. It's very important work, and a lot of things that you're mentioning, especially about the spinach and the oxalates, those are things that a lot of people are not aware of.
Yes, and that's why I wrote the book, because I just want to let more people know. And also the book is for practitioners so that they can have more tools in their toolbox to help more people.
Well, thank you so much, Jaclyn, for coming on today.
It was my pleasure. I really enjoyed speaking with you, and I will come back anytime to talk about the book or anything else and answer any questions.
Awesome. Thank you.
Thanks, Michelle.
So that concludes today's episode. You can find all of the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to share and leave a review. Reviews mean everything to podcasters, and I really enjoy hearing from my listeners. You can also find me on my website at www.thewholesomelotus.com or email me at info@thewholesomelotus.com. I love hearing from my listeners. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com. I thank you so much for listening in and hope that you have a beautiful day.